I'm the outreach and okay, thank you. I'm the outreach and education coordinator for the Wyoming Cancer Program. Oh, gotta use a clicker. All right. So, top of my screen's cut off here, but we'll start with a few of our breast cancer screening events. So throughout the year, the YCC was able to participate in various breast screening events. So these took place throughout the state, and they are a way for women to come to screenings if they're not able to go to a regular scheduled mammogram. They can actually come to an event and either get a mammogram or a clinical breast exam. And they were held in various places, as you can see here. We're able to do 7 different events and complete a total of 123 mammograms throughout the state. So these were held within various partnerships throughout the state, and the Wyoming Cancer Resource Services also helped out with many of these events throughout the state. The next one we have here is the Wyoming Breast Cancer Initiative. So they have a few different goals. The first goal that the Wyoming Breast Cancer Initiative has is to reduce structural barriers with breast cancer screening services available during weekend hours, extended hours, and alternative non-clinical settings, and in an individual's primary language. The second goal that the Wyoming Breast Cancer Initiative has is patient navigation assistance. So they provide an individual on a one-on-one basis to reduce barriers to care and encourage the completion of breast cancer screenings. And survivors, they also have a goal of survivorship funding. So it's to supportive services to survivors such as support groups and one-on-one counseling and breast fatigue services. So as you can see, WBCI has been very busy with all of the things that they do. So they were able to complete a little over 1,100 clinical breast exams and/or mammograms. And 428 of those were completed at an outreach event. They were able to help 223 individuals in their primary language. They were able to help 1,200 individuals receive patient navigation services. 478 lodging and/or gas vouchers were given out. 610 survivors received services. 95 support group sessions were reported, and 253 services in breast boutiques have been provided. So after all of those services, 100% of participants have self-reported an increase in their well-being with all of the supportive care that WBCI was able to help. So we love that WBCI has been able to be a part of the YCC. The next partnership that we have is Live Health. So Live Health, it has been able to provide telemedicine services, mental health counseling, and psychiatric medication management to individuals across the state of Wyoming with an active diagnosis of cancer or with a history of cancer treatment who need mental health assistance. So this program coined the term United in the Fight in 2019, and since then they've been able to, or since this last year, this was just this last year, they were able to navigate 32 individuals through to the services they need and help 53 individuals with case management services. The next one we have is colorectal cancer screening. So this is a pretty unique, both of these have been a pretty unique partnership that the Wyoming Cancer Resource Services have been able to help with. The first one was in a partnership with the Lore Foundation. If you're not familiar with that, that's a foundation that's out of Lander that works with people in rural places to improve the quality of life in those rural places. So one of our WCRS coordinators worked with that foundation to secure funds for at-home stool testing kits, so FIT kits for the community. So during the duration of that project, they were able to hand out 77 kits, and 41 of those kits were returned back for lab processing. So about a return rate of about 57%. 6 patients had positive test results and were able to receive further testing. But unfortunately, we didn't have any further data available if they weren't able to detect any cancers further with that one, but still a really successful project in partnership with the WCRS. And another really exciting project that we have going on currently right now is our WCRS Dama, who's over there, has a partnership with GI Associates here in Casper to assist with colonoscopies. So she worked with, she was able to receive a grant with Wyoming Community Grants to pay for about 15 colonoscopies. So all of the individuals that aren't able to receive the screening through the Wyoming colorectal cancer screening program will be able to get a colonoscopy through this program, or at least 15 of them. And so she's been working with the provider on a bundled price to be able to pay for these colonoscopies and 1 to 2 biopsies. And throughout this project, there's actually been a few hiccups, a few challenges, including the transition of a new WCRS coordinator. So Dana had to, kind of pick up the pieces where the previous WCRS coordinator had kind of laid the groundwork. So through that, she was able to kind of get everything back on track and going. And then on top of that, the provider that she was working with is actually hiring. So just challenge after challenge, and even through that, she's been able to kind of persevere through that. So we're super excited to kind of see where this project goes and maybe be able to kind of sustain that into the future. The next success we've got going here is skin cancer screening events. So not only do we have the breast cancer screening events, we're able to help with skin cancer screening. This last year, we had 3 throughout the state. So in Niobrara County, Fremont, and Natrona County. And this resulted in a total of 152 completed screenings, 1 referral for a biopsy, and 11 cancers found. So this is also another ongoing project that we're really hoping that we'll be able to continue into the future. And last but certainly not least, another community screening event that we've been able to get off the ground is a head and neck cancer screening. So here in Region 2, the WCRS partnered with Rocky Mountain Oncology to organize a free head and neck cancer screening event. So this one resulted in 18 completed screenings where 5 patients were referred for concerns. So another really exciting thing that we've always been able to participate in is sun safety. This one is actually right over here at David Street Station. So DAMA worked with them to secure a sun sail for their participants. So David Street Station participates in all kinds of free events for the community, and now they have this really amazing sun sail. And I think if it works, we've got maybe. Do you have the? I kind of a cool little snippet of what it looks like.
Is it this?
Just the heading. You click on the heading.
It's thinking about it.
If it doesn't, there's still.
There it goes. It's coming. Just a second.
Technology, it's the thing of the day.
Yeah, it just won't open. Just a second. Sorry. Go into Google. It wants to open it into a website that we don't have,
No
or
worries.
a browser we don't have. Sorry.
So, I mean, you can kind of see here that these are what the sun sails look like, and they provide shade to the families that participate in the various events that they have going at David Street Station. So even through this one, there was a few challenges with actually getting them ordered and getting them installed, and we kind of persevered through that. We're able to get them installed, so we're really excited that we're able to have these for years to come as well, because these will actually be permanent sun sails for everyone to use in years to come. So the next one we have here, maybe. So also on the sun safety front is our sunscreen dispensers. So they've always been a really huge hit every year. So in addition to the project that we've had going for quite a few years now with Wyoming State Parks, we do have, how many in Wyoming State Parks? There are sunscreen dispensers in all of our Wyoming State Parks, but the last year we actually implemented a application process so organizations can actually apply to have them with their organizations as well. So we had 8 applications, and we were able to find all of those organizations to put in a permanent dispenser installed into their organizations. And then on top of that, we have mobile sunscreen dispensers. So organizations can actually check out those for any of their events throughout the summer, really. So throughout this last summer, we had over 30 events check out these dispensers as well. So every year we kind of get more traction with these mobile sunscreen dispensers and more people knowing about them. So that's kind of been a really exciting success of the coalition as well. So that's really exciting. Something that the prevention work group has been working on is, the screening and early detection work group has been working on is a discussion guide brochure. So the guide was created as a conversation starter between patient and providers about cancer screenings. The goal is to have these brochures in providers' offices when the patient is waiting for their appointment, so they can pick these up and start a conversation. They also add in an area where the patient can make notes and other things that they want to discuss with their providers. And the goal is to get the provider talking about cancer screening. So the WYCC and the prevention work group is really excited to kind of roll these out as well. So this is kind of gives you a snapshot of what that discussion guide will look like. Another really exciting project that we did have in the works is the tomato plant project to promote healthy eating. So 100 seedlings were distributed between the Wind River Food Sovereignty Project and the Lander Food Bank. The original goal was 300, but it was really great that they were able to get 100 off the ground. A wrap card was created. So this is what the wrap card looked like. This is the front and this is the back of the card. And so with a seedling, the card was given out and it kind of just talked about healthy eating and your risks of disease and your risks of cancer if you don't eat healthy. These seedlings were given out with it. So again, 100 seedlings were given out this year. They're hoping this year, they're hoping to move the project into next year and get closer to that 300 goal into the years to come. Another really exciting thing that we do have with the WYCC is the Childhood Cancer Work Group worked on a pediatric cancer needs survey, and that's not showing up as well as I was hoping it would, but we did work on a childhood cancer needs survey wherein it was sent out to just about every family that is affected by cancer in Wyoming. And so this word cloud that you can't unfortunately see very well was created. I kind of created it with using those respondents' words. So these are the words that came out that were highlighted the most throughout our survey. So 50 respondents came back. 50 responses came back through this survey, which is really awesome that we were able to get that this first go around. And it was sent out through Jason's Friends and through the School Nurses Association, and which came back with a few key themes, which ended up being mental health support, marriage counseling, family sessions, sibling support, group sessions, a need for increased hospice care, and access to PT and OT. So, and you can kind of see through those key themes, they all kind of show up through this word cloud here as well. So we're really excited to kind of see where we can take that and what needs we can address through that as well. Another really exciting thing on the docket here is the governor did declare September as Childhood Cancer Awareness Month. Jason's Friends worked with the governor and got this declaration off the ground. So this got us one step closer to reducing the burden of cancer in Wyoming. And you can see one of the adorable fighters here in the picture holding up that proclamation. So really exciting news that we were able to get that as well. Wanted to highlight Camp Courage 2022. So Camp Courage is made possible by the Jason's Friends Foundation. And if nobody is familiar, or some people may not be familiar with that, Camp Courage Wyoming is the only childhood cancer camp in the state of Wyoming. It was created in 2012 and provides a venue to bring childhood cancer patients and survivors and their parents, siblings together to create, to connect with other Wyoming families who travel out of state for treatment. So it's held annually in August and it's offered to Wyoming families, includes activities like horseback riding, arts and crafts, fishing, campfires, and entertainment. So it's made possible through grants and individual donations, and it just allows families to attend the camp free of charge. So here's a few pictures from this last Camp Courage. Another really exciting thing that we've got going right now is the substance use and tobacco prevention program worked with the prevention work group on a nicotine-free schools toolkit, which includes a comprehensive school policy for schools and community members. The toolkit also promotes healthy messaging, the My Life and My Quit. The toolkit offers alternatives to punishment when a student or staff member or administrator has violated the policy. such as to provide youth with education and resources. So it's in its final stages of routing before it's ready to be implemented. And the plan is to send it out to each county prevention specialist, along with an updated list of every school district's nicotine-free policy. And it will be tracked whether each district has a complement. An evaluator will track whether each district has a policy in place. So this will allow the toolkit to be a resource when the prevention specialists reach out to counties to help them update their policies. So this gives you an idea of what it will look like when it is implemented. We did hold a couple of annual cancer survivor lunches. This is a few pictures from those this last year. So these are pictures from one that was held in Casper and one that was held in Cheyenne. In Casper, the one was in partnership with Rocky Mountain Oncology, and food was provided for survivors, and a banner was purchased where survivors were able to write on in memory of or in honor of. And then there was one held in Cheyenne in partnership with the Cheyenne Regional Medical Center's Cancer Center, where a guest speaker was able to come up and tell her story about the difficulty she had along the way and the care that she received at the Cancer Center. So the next thing that that's weird. This doesn't have the last slide. That's really odd. It doesn't have your the thing you wanted to talk about. So we'll bring Star up and Star will talk about it. But it had a really cool picture that I wanted to show. So.
Oh, it does have my picture. We don't need to show that.
So I'll let Star talk.
Well, first, I just want to say like a round of applause for all of you working in the community. So this is just a highlight of all the things that you've accomplished, and we just wanted to make sure that you were recognized for the efforts that you have done. So a big round of applause. There's the WCRS over there. The work that we talk about in the coalition, again, it's a group of people that come together to share what they're working on, and they do this work in the community. So while the coalition is the name of all of these people together, you're the people that do the work in the communities. And so this could not be accomplished without you, and we really appreciate all of the things that you do. The lovely picture that Jess doesn't get to show, which is fine, is that we were invited to present a colorectal information about the latest the latest recommendation changes. And I'm pleased to announce that there is a draft bill that is expected to be on the docket for the upcoming legislative session that will update the colorectal cancer statute in Wyoming. So it will remove the age 50 guideline. It will update some language, but it will make it so that cancer screenings are more accessible, and that we're able to change guidelines to align with national recommendations more easily. So definitely keep that on your radar. I believe, as far as we know, unless some other pressing issue kicks it off the docket, it is going to be up there for whatever they do at the legislation session. So, it's that mystic magic that we don't get to see, and you might fall asleep if you do watch some of the sessions. Not all of them, but some. Okay, so what we would like to do now is just to open it up for anyone else to come and talk about something. If we didn't capture it in this presentation, we tried to scour all of your social media pages. We got all the reports from our grantees that we were able to report on, but we're not able to report out everything because we just simply can't be everywhere all at once. So I'd like to open the floor up. I know Allie's going to come up and talk. Yes. Oh, somebody else. Somebody from that table back there is going to talk, and then we'll open it for other people. And then whatever time we have left, we'll be networking. I know you guys have been so quiet.
Hello, my name is Christine Robinson, and I'm the Executive Director for Jason's Friends Foundation. And I wanted just to speak on a few things, and just listening to this information this morning with the two speakers. There definitely is a need for other adult assistance, and one of the things that came to my mind, we partnered with Brent's Place back in 2017, and that is a home in Denver for our families. They're down there long-term, short-term, and that's where we house them. It's a place that's close to the hospital. It's a place for support, counseling, and so many other things. They do have an adult unit. They do have adult places, and they are supporting adults in cancer as well. So something maybe to look into more or as another resource for your families as well. With Brent's Place, we are also finding the need with our families going to Salt Lake as well. And it's a huge hope for us that we work towards and are in process of having such a place in Salt Lake as well. One thing new for Jason's Friends this year, which we celebrate and has been very utilized by our families, insurance. Insurance was brought up. Jason's Friends started January 1st. We actually assist families with the child with cancer. We reimburse them up to their deductible for that child. So in reality, they are walking away. They're not having all that out of pocket. The first time I saw on an application, a child's deductible of $10,000 was one of the first times I thought, this is a need. And we were blessed with a grant that came to our foundation, and our board chose to earmark that for this. That started on January 1st. So that's a huge blessing for our families with private insurance. We have 151 families right now. We have 3 in the works, and our numbers continually increase. We just recently, actually yesterday, I was looking at something, and in 2013, so 9 years ago, we had 77 enrolled in our program. So our numbers just keep growing, and need has not slowed down. So in the childhood cancer arena, it's still full force as well and going on high. We've lost, sadly, 5 children so far this year, and we have one that is heading that way with a terminal diagnosis, sadly. I just wanted to kind of thank you for acknowledging our proclamation work. My team and I did travel last week to Denver, and then the proclamation was read by the governor, and he signed it for us. So that was a huge thing. That was actually one of our students in the picture, and we actually met her on our trip. We met her in the hospital. So that's a very cool thing. So thank you for letting me talk to you. Oh, yes, I have a question.
More about the 4th floor of Brent's Place.
Yeah. So with Brent's Place, we started that partnership in 2017, but new this year, we have grown so much, and the need is huge for long-term housing for our families down in Denver, that we actually took over a floor at Brent's Place. So we have a Jason's Friends Foundation floor at the Brent's Place. We have 4 2-bedroom apartments and 2 suites for short-term stays. And even then, we still are utilizing other spaces, but it's a huge, powerful floor. We've decorated it to be Wyoming. So the families that stay in these apartments and suites get to enjoy pictures of everything great about Wyoming. And all we've heard is how much they feel like they're at home. Networking is also huge, because every family that's on that floor knows they're from Wyoming, and friendships and networking has been huge for our families. So we just lost a family, the one that's about ready to lose their child. They have connected, and that is big, and that's just been a big hope for ours, and it's happening.
Thank you so much. We have someone online that has, one second here.
Whenever you're ready.
We're ready for you, Dr. Symington.
Thank you. Okay, I'm Banu Symington. I'm a medical oncologist, hematologist, medical director of the Sweetwater Cancer Center. I I want to ask this group, Kathy Bledsoe pointed out that financial concerns occur in about 100% of surveyed survivors. We know that you cannot get cancer care in the ER. We know that since Medicaid expansion, outcomes for cancer, both early detection and improved survival, have been shown for many, many cancers. I have tried to lobby the state legislators and national legislators to get them to accept Medicaid expansion. I'd like to know if this group is trying to do anything. We are a cancer council, Wyoming Cancer Coalition. We have data that shows associations between access to healthcare and improved outcomes. Are we doing anything to assure that our citizens will have better access to healthcare through Medicaid expansion specifically?
And also just to let everybody know, if anybody's interested in learning more about IQ extension or talking more about it, we do have a lot of information that we can share here with you if you're interested in it. Thank you. Fine, Ariel, after chat with her. There's an echo.
Something has happened. I can't hear any answers or speech.
Okay. Thank you.
Okay, sorry about that, Dr. Symington. So Ariel from American Cancer Society is here, and she was talking about how they are actively working towards that. And so the guidance remains the same, that as a coalition, we are not allowed to lobby. We can educate. And so she asked about data and presenting data, and you can prepare that. But the real work in that lobbying part will take place as individual organizations or as a community. It's not taking place as a coalition at this time, just because of the way that we're structured and the way that we're funded. I hope that as it being in our cancer plan, that's what we work towards over the next few years, because we have heard that message that you guys bring. And, you know, we want to acknowledge that, but at this time we have those limitations in place. All right, does anyone else want to present any success stories or any great, amazing work that they're doing in the communities? Otherwise, we have about 20 minutes to network, get up, stretch, do all that. And then our next presentation starts at 1:15.